Thank you for calling the Aetna Medicare Advantage Member Services Team for MTA New York City Transit retirees. This call is being recorded for quality and other healthcare operations purposes. For questions about your new plan benefits, starting on January 1st, or to register for an informational meeting, press or say 1. If you are a current MTA Aetna Medicare Advantage plan member and have questions on your current plan, press or say 2. Sorry, let's try again. Enter or say the month, day, and year of the date of birth of the person you're calling about. Do you have your 12-digit member ID number? Press 1 for yes. Press 2 for... Please enter or say the member's 12-digit ID number. Correct?
Yes.
To request a replacement ID card, say ID card. For basic claim status, including amount submitted, paid amount, and patient responsibility, say claims. If you would like to find a provider or request a provider directory, say find care. For all other questions, say representative. To hear that again, say repeat.
Representative.
Your feedback is important to us. You may have an opportunity to give us feedback on today's call. After speaking with the representative, please stay on the line to complete a brief survey. Please hold while I transfer your call. Hello, good afternoon. This is Debbie. Do I have the pleasure? And tell me, how can I help?
Yes, I have a couple of questions about the new coverage that I'm going to get on January 1st. The first thing is, okay, what's the other hospital? The hospital for special surgery. Is that hospital in network?
And that's the name? Hospital for Special Service?
That's the name, right?
Hospital for Special Surgery.
Surgery.
Correct.
In New York, okay. Okay, and that is on the 70th Street?
Yes.
Is that the location? Okay. Okay, that one is not working with the plan. Let me check another location. Fine.
with that hospital, any location is working with the plan. Let me check you on the update.
So the hospital for
sure how
special
far it is.
surgery, so the hospital for special surgery in Manhattan on 70th Street is not in the Aetna network.
No. Actually, any location.
In
All their
any,
locations. Wow.
They have a location in Lexington Avenue, 523 is 7th Street, 541 is 70th Street, one on Uniondale, and one 535 East 70th Street, and any of those.
and
They're
so
not
what,
in that.
what would happen if we wanted to use that hospital or one of the doctors affiliated with it?
Sometimes, just depending on, sometimes they let the provider choose their plan, sometimes they don't. So in that case, we can look at the name of that provider specifically, if it's working with the plan or not. But like I said, he has benefits out of the network, so he can still have services from them. What happens is that sometimes they require the payment upfront if they don't bill the insurance directly. So that's when it comes. Let's say if for a chemotherapy they charge $500 is easy. So and Medicare pays only $300. Then Medicare will refund to the member only $300 instead of the $500. So
Okay.
he instead of paying $5, he will pay $205
For every visit,
Okay.
for every visit.
for every visit, yeah. And with that, whether it's in network or out of network, do we still need to have prior authorization for these treatments?
It's just depending on the treatment. So if the doctor, for pre-authorizations, we look with the service code. So each code, it has or not, just depending on the service. And that's doctor responsibility. I mean, if they're gonna need to do some procedure on the member, they need to verify with the insurance and run benefits and verify if that procedure will require a pre-authorization. And that back end work is usually done by the doctor.
Is there a list of all these prior authorizations required under this plan?
We have a list that we use to verify
Are
for
you-
procedures.
Are you able to email that to us?
Oh, no.
So
What do you
That's
mean?
not something that we can share. No. I mean, I can look with if I know the code, I can search under that list, but that is something that is not like available, accessible to the public.
So if I logged onto my Aetna account, would I be able to see a list of what needs pre-authorization?
No, like I said, that's not a public record.
Oh.
We have a list that Medicare shows with us, so we can see what services require a pre-authorization or not. That's not a public information.
Oh, okay, because
That is not something we can share.
I recently received a book in the mail from Aetna outlining my new plan coming in January, and in there, you know, page after page, it has a list of services that need pre-authorization. But
Okay. Got it.
oh, so then that's what I would go by.
But there's more than that.
Like I said, your doctor, depending on the service, once they run benefits, they going to see if that requires or not pre-authorization. So it's just depending on the diagnostic, it's just depending the service the doctor consider you're gonna have, then you're gonna see, okay, well, this service require or not, and that back end work that is done by your doctor. So The only thing you need to know is, okay, where I need to go at what time. And that works filing the pre-authorization, sending the clinicals, and dealing with the insurance. That's your doctor's responsibility. You can do it you as a member, but we always recommend to let the doctor do that because they have your clinical file.
Okay,
Well, I think we understand that. I
It's
think
not
that,
all the services that require a pre-out. So let's say an MRI, for example, usually requires a pre-authorization. Usually, maybe chemotherapy. I'm thinking it will require a pre-authorization because it's kind of a major
yes,
service. So it's just depending on the service. But if you have like a general list there, you can go with that, but each case is different. So just let the doctor do that.
well, I think it would just be
Once you have a
helpful.
scheduled service,
It would just be helpful to know what the prior authorizations are. I mean, if this is the insurance that covers us, then we should know what's expected of us. What does require prior authorization, right?
yeah,
yeah, I mean, I can check. To be honest with you, I have never seen a public list, but I can double check with my supervisor. I might be wrong.
Well, could you please? That would be helpful.
Yes, of course. Give me a moment, okay? I'm
Sure.
gonna double.
thank you.
See how exasperating these calls get?
I can't hear with all that music in the background.
You see how exasperating these calls get?
Yes, exactly, yeah. I know. And I don't understand why she can't email a list of prior authorizations, so I got a book in the mail from about it.
But they didn't list them all.
Well, that's, of course, they're gonna list just the ones they want you to know about.
Yes.
Amazing, right?
That's crazy.
Thank you so much for holding. We are on the waiting line, okay? Give me a few moments.
Okay, thank you. It locked me out. That's coverage, active coverage. Where's my claims?
Thank you for holding. We're still waiting, okay? Give me a few more moments. And in the meantime, I wait for them. What is the other question you guys have?
Oh, what is it, Stony Brook?
Right. Stony Brook University Hospital.
Stony Brook University Hospital. I need to know if that's in network. And I believe that's in,
Stony Brook?
yes, I believe that's in Long Island, right?
Yes, Stony Brook, Long Island.
Hmm.
Okay. Okay, so the city is Stony Brook, right?
No,
Stony Brook, New York?
yes, Stony Brook, New York.
Okay, give me a few.
I'm gonna be hearing this music all day long. This-
Thank you so much for holding. So yeah, we don't share our fees, and they are inviting to go to Medicare.com. So probably on Medicare.com, you can find a list, pre-authorization, like a list of services that require a pre-authorization.
On Medicare.com has a list of pre-authorizations?
They may have.
Oh, they may have.
They may have.
No, no,
Um,
no.
We don't share our list. We don't publish our list.
Okay,
That is something that we cannot publish.
So you're
Okay.
saying,
But Medicare.com may have a list of services that
Okay.
require a
okay, hold on a second. Aetna Medicare is not Medicare. Aetna Medicare Advantage is not Medicare. You're a privatized plan, so
yes,
we follow Medicare guidelines. So Medicare is set out all guidelines under this plan. So this plan has a lot more coverage than original here, but we
Okay.
are attached to Medicare.
right, but I don't get a prior authorization for an MRI or chemo. And you're telling me under your plan you do. So in that instance, I tend to disagree with whoever you just asked, because Medicare does not.
Okay, look, you oversee it. So in the case the provider requires a service done on the member, the provider will run benefits, and the provider will verify if that procedure requires or not pre-authorization.
But then,
Our list, where we can find that information is not a public information. There is something we don't share.
oh, okay,
If you want to have a little more information, you may ask your doctor about the code, and sure with that code we can verify that.
unbelievable.
okay.
Okay, and for the university hospital, Stony Brook, they don't work with any plan with Aetna.
They don't work with any Aetna plan.
No,
Okay.
not even commercial.
Oh, all right,
And what-
darling. Is that all the questions you have?
I have two more, actually. What would happen now if we wanted to go to the doctor at Stony Brook? What would happen there?
He had a benefit out of the network as well at the same rate. But what happens with providers out of the network is sometimes they don't bill the insurance. They don't deal with billing process. So the member will require for a payment upfront, and then the member can get reimbursed for that expense up to the maximum rate allowed by the.
Reimbursed. What is the procedure? If I submit you a bill for $1,000 up to the maximum of what Medicare would allow, you would just pay it, or are we gonna have to like fight to get that reimbursed?
I don't understand what you mean by.
I mean, if we just submit a bill, you just reimburse it up to the maximum, or is there like a whole approval procedure? You approve it for medical necessity, or there's some other reason?
No, I mean, okay. So if the doctor, it's just depending on the service. If the doctor will, like the jelly shot, for example, on the knees, if that shot require a pre-authorization and the doctor performed the service or have the pre-authorization and the doctor requires for a payment up front, the member will pay, the member will receive the medication. But once he filed the reimbursement, and if the shot require a pre-authorization, maybe the insurance will deny that because the procedure is have that pre-authorization on file to pay that for the shot. That's an example, right? So it's always better before get done any service of this endole, not just a doctor's office, a doctor's specialist office visit, that's standard. He doesn't have to have a pre-authorization to see a cardiologist or to see a chiropractor. We're talking about different services that are outside of the normal visit, like the shot, for example, or an MRI, or a surgery, or the chemotherapy, things like that.
So
Okay.
But when you
in-network,
visit the provider, you don't need a pre-authorization for that.
no, I understand that, but for tests or procedures, whether they're in-network or out-of-network, then they would require prior authorization?
Some of them, not all of them, some.
Even out-of-network, even an out-of-network provider?
Yeah, the in and out of the network only means if the provider has or not a contract with them.
Okay,
Got it.
so,
Is there,
so to reiterate, we would need prior authorization no matter what, whether we go to an in-network provider or an out-of-network provider, depending on the procedure. And
Depending on the service.
right,
yes.
and if I went to an out-of-network provider for a procedure and I had the authorization for it, and the bill was $1,000, but the out-of-network benefits only pay up to, let's say, $700, then I would be responsible for the other 300.
Yes, correct. And we can give you a quote, an approx quote with that service, for that service, so you can have an idea how much is gonna be the maximum rate.
Oh, so with the pre-authorization, we would get the amount that you would pay towards that procedure if it was an
Yes,
out-of-network
the
doctor.
provider can give you that, yes.
Okay,
The provider can give you that statement, or you can call us, whatever is easy for you.
let me
Okay.
ask,
And they know,
let me ask you a question. In that situation that he just gave you, if we're stuck out of pocket for that remaining amount of money, does that go applied towards the maximum out of pocket?
no,
No. Okay.
no, only the copayment or co-insurance or co-shares.